Hello, friends. Myself, Dr. Atul Ingle. I'm a director of nephrology at Fortis Group of Hospitals, particularly Vashi and Mulund. As you know, second Thursday of every March is celebrated as World Kidney Day. Now, why this World Kidney Day has to be celebrated? Basically, because the kidney problem, a chronic kidney disease, is increasing like anything. CKD is the number 12th cause of death all over the world, or it almost affects the life of 1.2 million people. So, to increase the awareness, World Kidney Day is celebrated. So, just last Thursday, 9th March, World Kidney Day was there. So, pertaining to that, I thought I should have some message related to chronic kidney disease. And today I'm going to select the topic of diabetic kidney disease because, as you know, diabetes is number one cause of chronic kidney disease. If you compare the two types of diabetes, that is type 1 and type 2, type 1 means which starts at the younger age, it hardly affects 4% of people, but 96% of diabetic kidney disease is because of type 2 diabetes. It has become so common that if you randomly select three type 2 diabetic person, one would have chronic kidney disease. Believe me, this chronic kidney disease in diabetes, or also known as diabetic kidney disease, is doesn't come with symptoms and signs. It has to be detected to the screening test of the urine and the blood, that is serum creatinine. So if you are diabetic, then I would suggest you to check for the kidney function on the day one itself, means when you diagnosed to have type 2 diabetes, or subsequently every 6 months or 1 year. But trust your doctor, trust your consultant, and be in touch with him related to the kidney function. Just in brief about how to detect this diabetic kidney disease. Basically, there are two criteria. One criteria is leakage of protein in the urine. Also, we call it as a albuminuria or ACR, that is albumin creatinine ratio. If that is present in the urine, you can have diabetic kidney disease. The other criteria is a kidney function, that is a filtration rate, also known as GFR. What we calculate is known as EGFR, that is estimated GFR. If it is less than 60, then again there are very high chances that you can have diabetic kidney disease. Now, how to prevent? Basically, prevention is better than cure, because once you diagnose to have chronic kidney disease or diabetic kidney disease, it is a progressive, there is no u-turn. You can only slow down the progression. So earlier detection and earlier treatment is the best option. The treatment should be very aggressive, means control of blood sugar and control of blood sugar. Many studies have also shown that insulin is better option for the treatment of type 2 diabetes, though there are new medicated groups have come up, like SGLT2 inhibitor or DPP4 inhibitor or GLP-1 analog, which are used in the initial stages of type 2 diabetes, are also very good in preventing or slowing down progression of chronic kidney disease. If you ask me in simple, what should be the target of the sugar? The target of the sugar in diabetic kidney disease should be around 7% or less than 7%. That is HbA1c, what I am talking about. About the blood pressure, it should be around 130 over 80. This is not a time or place to discuss about what medications you should use for treating hyperglycemia or high sugar, or what medication you should use for blood pressure. Better you should have consultation with your own doctor. This is just to brief you about what do you mean by diabetic kidney disease, why it should be taken seriously, and the most importantly, that it is to be screened out, not it doesn't present with any signs or symptoms. So be careful the people who have diabetes or hypertension. Basically, these are number one and number two causes of chronic kidney disease in this world. Thank you so much for my message and patient listening.